Imagine driving home with your 1-year-old child sitting in the back seat. You are crossing an intersection when all of a sudden, a van hits you from the side. Luckily, no major injuries were reported. However, the impact shattered the window glass, which made several cuts on your child's arm. The ambulance arrives to help treat the minor cuts, but the blood continues to gush heavily. Your child is immediately transported to the nearest hospital, but upon arrival, he was already in shock. After stabilizing the child, a doctor approaches you. "Ma'am, your child has hemophilia." What is hemophilia? Hemophilia is a bleeding disorder in which the blood does not clot normally due to irregular levels of clotting factors in the blood. Clotting factors are special proteins that work with platelets to create a normal blood clot to stop the bleeding. The genes that code for the blood clotting factor are found only on the X chromosomes. Hemophiliacs have a defect in one of the genes that instruct the cells to make the clotting factor protein. Females have 2 X chromosomes, while males have 1 X chromosome and 1 Y chromosome. Because males only have 1 X chromosome, the disorder is more common in the male population. Approximately 1 in every 5,000 males is born with hemophilia annually. For female carriers, the normal X chromosome usually produces enough clotting factor to prevent serious bleeding issues. Female carriers do not show signs and symptoms of hemophilia, but are capable of passing the defective gene onto their children. There are 2 types of hemophilias, hemophilia A and hemophilia B. People with hemophilia A are missing or have low levels of clotting factor number 8. In fact, 80% of hemophiliacs have type A. On the other hand, people with hemophilia B are missing or have abnormal levels of clotting factor number 9. The probability that an offspring will have hemophilia can be determined by using a Punnett square. Hemophilia is a recessive genetic disorder. Imagine this scenario. The father is a hemophiliac while the mother does not have hemophilia. Each daughter would inherit a faulty gene from the father and a normal gene from the mother, making each a carrier. None of the sons will have the disorder because the males will receive a Y chromosome from the father and a normal X chromosome from the mother. Different inheritance patterns can occur depending on the traits of the parents. Hemophilia is usually inherited, although in some cases it can be acquired within one's lifetime. In these rare cases, the body produces antibodies that attack the clotting proteins. Excessive bleeding, both internally and externally, and easily bruising are major signs and symptoms of hemophilia. Examples of internal bleeding in hemophiliacs include blood in urine, blood in stool, and large bruises. People with hemophilia may experience bleeding in the joints, especially the knees and elbows. They often complain of tightness, swelling, and pain in the joints. Eventually, the range of motion of the joints is temporarily decreased. If left untreated, pain can become severe and the joint can be damaged. Hemophiliacs must also be cautious of cerebral hemorrhages. In order to diagnose hemophilia, a doctor first asks about personal and family medical histories. Then, a CBC or complete blood count measures the levels of hemoglobin, red blood cells, white blood cells, and platelets in the blood. Because people with hemophilia bleed longer and more heavily, the hemoglobin levels and red blood cell count may be low. In addition, the activated partial thromboplastin time test records how long it takes for factors 8, 9, 11, and 12 to clot. Because hemophilia occurs when there are low levels of factors 8 and 9, the APTT test would indicate a longer clotting time. To add on, a fibrinogen test assesses the ability to create a blood clot and is performed when a patient has abnormal APTT tests. Clotting factor tests, or factor assays, determine the type of hemophilia and how severe the disorder is. The irregular levels of factors 8 and 9 are measured in order to characterize the disorder as mild, moderate, or severe. A non-hemophiliac has 50 to 100% of the clotting factor 8 or 9 in the blood. Mild hemophilia occurs when there is greater than 5% but less than 50% of clotting factors, while moderate hemophilia occurs when levels are between 1% and 5% inclusive. Less than 1% of the protein in the blood results in severe hemophilia. 70% of hemophiliacs with type A have the severe form. One way to treat hemophilia is to use replacement therapy. The lack of clotting factors allows bleeding to continue. Depending on which type of hemophilia, concentrations of clotting factor 8 or 9 are injected into the vein to replace missing or low levels of clotting factors. The additional factor from replacement therapy helps stop and prevents bleeding. Desmopressin, a man-made hormone used to treat mild hemophilia A, is administered either by injection or by nasal spray. The drug stimulates the release of stored clotting factor VIII and von Willebrand factor. To add on, antifibrinolytic medicines are used along with replacement therapy. Given as a pill, the medication prevents blood clots from breaking down. March is Hemophilia Awareness Month. Please bring awareness and attention to those living with this bleeding disorder.